Hi, my name is Renee Korczak. I'm a sports dietitian for nutrition counseling services at RWJBarnabas Health Ambulatory Care Center. I partner and work very closely with collegiate and high school teams and also work closely with the Matthew J. Morahan II Health Assessment Center for athletes. I'm excited to talk about body composition in this presentation. So, what is body composition? It really is the body's relative amount of fat and lean body tissue, and there's many components of that, including your muscle, bone, organs, and tissues, as well as water. In sports nutrition and even just in sports science, we do evaluate body composition, and we do that really to help assess health risks and determine if there's needed behavior changes for optimal health. And really, then for athletes, it's really to determine their best body composition for performance and their respective sports. So, different sports have different energy systems that they're using and different physiques that are kind of more acclimated towards that particular sport, or you might be working with an athlete who wants to improve their lean body mass, reduce some storage fat. So it's important to understand body composition kind of at a baseline if you're to take those measurements, during preseason, and then as you're working with the athlete and they're tracking nicely, you would kind of track them again during that postseason phase or even end of season to see if there's been any improvements in body composition. So as you can see, just really basically here, there are gender differences when it comes to body composition. We all have different physiques, we come in different shapes and sizes, so that totally makes sense, right? In terms of just kind of looking at men and women here by side, this is just some kind of average representative data. You can see that men have, higher percentage of muscle mass typically, and then we see bone. Men have slightly higher percentage of bone when that ladders up to body composition. And then we see some variability in storage and essential fat. Essential fat is kind of the fat you need to help cushion your internal organs and support bodily functions. And then storage fat is basically fat that you store in adipose tissue. So very normal to see differences amongst genders and then even amongst different athletes in different sports, which actually leads me to this slide. So this is kind of a busy slide. I'm not going to talk through all of it. I think the big picture here is it kind of alludes to my last point, right, where I was saying we all come in different shapes and sizes. There's body composition differences in various sports. And this slide does a really good job of breaking that data down. So this actually came from a publication. It's older now, 2010, but I think it's still very valid because it shows, just how different males and females are across all of these various sports. You can see the variability even in a sport like track and field and shot putters, where females have body composition between 20 and 28%, and men are on the lower side, and sport like basketball or cycling, where body composition in males and kind of body fat is quite low compared to females. So it just goes to show you how different each of us really are. Training and nutrition. Body composition does not directly determine performance necessarily. However, it might be related to measure depending on the athlete, sport, and type. So when we take body composition measurements, you can do that by looking at skin fold thickness. You can do DEXA scans. You can do a number of different measurements. There are higher, more throughput technologies, which we'll talk about at the end of this presentation, that really can help scan the body and really show you a breakdown of your data and where your pockets of body fat are. So those measurements are really great because that's useful to a sports dietitian, that's useful to healthcare practitioners to see what focal areas, if an athlete has a goal to reduce body fat and really help tone the waist, or they want to gain more lean mass in their arms, it's important to track that data. Factors to consider when assessing body composition in athletes. One of the things I always ask when I work one-to-one with an athlete is you want to understand their goals, just like with any client. So if they have a goal to increase lean mass, you want to take that into account with recommendations you're giving and certainly nutrition interventions. And then, make sure you're getting body composition data over time to track and see how they're improving. Um, in terms of resources and methods, some methods are more costly than others. There might be equipment that's available to you or not. And then, you always want to make sure the methods you're using are valid, accurate, and of course, reliable. So, if you are wondering how to partner with a sports dietitian to help you with body composition, if you're curious, if you want to make an appointment, please call Nutrition Counseling Services at the number listed on this slide, or you can use our website to gain more information about requesting an appointment and just see some of the services we offer. The Matthew J. Morahan II Health Assessment Center has a specific body composition machine that's actually very high tech. It's called the StykeU. So this is really a high tech device that uses 3D body scanning technology to measure your body composition and physical data. And then it breaks out into a really nice report, and you would review that with the sports dietitian and really see your overall body composition. So it is pretty neat. It is a newer scanning technology, and it really just takes a few minutes to scan the whole body and to see that full picture. So if you're interested in working with a dietitian, interested in like you, all of that information is here, and we hope to partner with you in the future.